My wife came in the room, in the bedroom where I was spending almost all my time now, and said, hey, we're gonna go to the store. I caught them just as they were going out the door. I said, wait, stop, change your plans. I said, I need y'all to take me to the emergency room. And then I told my wife then, I said, and I'm not coming back home. Because that's where I was at that point. I really didn't think I'd be alive the next day. I retired in 2012 with full plans of physical activity and everything else, not thinking I had anything serious and thought I was in the best shape of my life. I noticed that when I walked from my backyard up to the front yard, I was starting to get short of breath. Finally went in and to see my primary care doctor, and he came back and said, you've got congestive heart failure. And he told me this is probably going to get worse. Local cardiologist referred me to Ochsner Medical Center because Ochsner was famous for its heart transplants.
Dr. Williams actually came to us through the heart failure service. And at that time, we started evaluating him for his heart failure symptoms and his admissions to the hospital. So this is a very unusual case. In this, the patient was suffering from a disease called as amyloid, which was depositing amyloid in the heart and causing his heart to be in heart failure.
amyloidosis, amyloidosis, which better known as an ATTR subtype, that makes abnormal proteins, and the liver abnormally folds, shapes those proteins. They get into the bloodstream, travel, and they get deposited in places they shouldn't be deposited because of that. And namely into my peripheral nerves and into my heart muscle. And then I had a pretty good idea what the prognosis was, because once that particular disease has been diagnosed, from the time of diagnosis, you only have about 2 or 3 years left to live. So you could pretty much start counting down the time at that point. Then they began to talk to me about combined transplant. Not just a heart transplant, but a liver transplant as well. Since the liver was abnormally folding the proteins, it's the culprit in making the abnormal proteins. So if I got a new heart and the liver stayed in, it would just continue to make abnormal proteins and eventually ruin that heart as well.
Heart liver transplant is unique in the sense that there are not a lot of patients that need these two organs. Patients either need a liver transplant or a heart transplant, but a very few select patients would benefit from both.
When they told me, they said, well, we got to be honest with you on this too, is that we've never done a combined heart-liver transplant here. You'll be the first one if we do it. Unlock my bed, roll me down to surgery, let's get it done. I woke up about 3 days later, and they came in and told me shortly after that, congratulations, successful heart and liver transplant. You got a new heart, new liver in you. I am forever indebted to Ochsner. And especially these doctors and nurses, the technicians, the teams, their reactions, their emotions, their faces, the way they looked after me clearly gave me evidence that they cared.
That we develop a very special bond with these patients. It's hard to describe in words because it seems that they become our family members.
Each morning I wake up now, first thing I do, as soon as I open my eyes and see the sunlight, is I thank God for giving me a new day as a gift of life.